Neurology Quiz number 14. What is distal acquired demyelinating symmetric neuropathy or DADS neuropathy? This is a CIDP variant. In contrast to typical CIDP, patients have slowly evolving distal sensory symptoms, tremor and sensory ataxia. Weakness, if present, is mild and confined to the distal legs. Up to two-thirds of these patients have a monoclonal IgM gammopathy, and 50% of those harbor anti-myelin-associated glycoprotein or anti-MAG antibody. EMG and nerve conduction studies show reduced motor conduction velocities with disproportionate prolongation of distal motor latencies and diminished sensory amplitudes. CSF protein is usually normal. Course is often indolent, but treatment may be required for ataxia and weakness. However, response can be minimal to agents like steroids, IVIG, or plasma exchange. Rituximab has been reported to be of benefit. Patient with DADS neuropathy without IgM gammopathy and anti-MAG antibody may respond better to conventional treatments. What is hemiplegic migraine? It is a rare subtype of migraine with aura, with motor weakness as an aura manifestation. It may be sporadic or familial. Familial hemiplegic migraine is autosomal dominant and begins during childhood or adolescence. Type 1 is caused by mutations in a calcium channel gene and is the most common. Type 2 is due to mutations in a sodium-potassium ATPase gene, and type 3 is due to mutations in a sodium channel gene. Type 4 has no gene mutations identified. Weakness during the aura usually occurs over 20 to 30 minutes and affects the face and arm and sometimes the leg. Other aura symptoms, which can be visual or sensory, are common. Headache usually occurs during the aura but may follow it. Symptoms can last for a few hours to a few days. Severe attacks may be associated with encephalopathy or coma. Symptoms resolve completely in the majority. Triptans and ergots are avoided as abortive treatment, as theoretically they can exacerbate ischemia. Acute episodes are treated with NSAIDs and antiemetics. Agents used for prophylaxis include verapamil, flunarizine, acetazolamide, topiramate, and lamotrigine. What is the indication for the drug Dalfampridine or Ampyra? Dalfampridine, an extended-release formulation of 4-aminopyridine, is approved in the US to improve walking speed in patients with MS. It is an inhibitor of voltage-dependent potassium channels, and blockade of these channels likely delays repolarization, increases action potential duration, and improves conduction in demyelinated axons. In randomized controlled trials, the drug was shown to improve walking speed as well as lower extremity strength in responding patients. The dose is 10 milligrams twice daily, 12 hours apart. Most frequent side effects are UTI, insomnia, dizziness, headache, nausea, and paresthesias. It is contraindicated in patients with history of seizures as it lowers the seizure threshold. It is excreted by the kidney and is contraindicated in patients with moderate and severe renal insufficiency. If no significant change is seen in the first 2 months, the medication is unlikely to provide benefit with more prolonged use.